Hey, what's up folks? This is Quace Fulton at the StretchBot, and today we're going to talk about what is fascial stretch therapy. But before you do that, if you like our content, go ahead and click like, and if you watch the end of the video, make sure you get a free gift from us. Okay, so before we figure out, or before I show you what is fascial stretch therapy is, you gotta first know what fascia is.
Imagine it's this web of tissue that surrounds everything in your body.
Now, I'm sure you're asking the question, okay, well, what does that have to do with fascial stretch therapy and why do I need it? So what actually happens to the fascia over time? When you're a kid, you can move around, you can do cartwheels, you can touch your toes, you can do things like that.
Then as the years pass, you realize, hey, I can't do what I used to do. Why? Well, you are what you eat. And you have to make choices on eating inflammatory food or not so inflammatory food, which helps the fascia stay healthy, which you can move better. And these are the choices you got to make. Now let's talk about trigger points.
Say you have a rubber band and it moves like this. And that's you moving your arm to a certain extent. Now it gets this thing trigger point and it gets balled up. It gets balled up. Now you want to go the same distance, but that knot is actually keeping you from moving, which sometimes actually ends up with pain. So that's what's happening. That's what's keeping you from moving. Now you can do fascial stretch therapy on yourself, and you need a couple of tools to do it.
There's three things I like to use: a lacrosse ball, a Tim Tam, and a good old foam roller. And here you can do something called active isolated stretching, where you prepare to just stretch one isolated muscle, actively contract the muscle, which relaxes the opposite muscle, and hold it for 2 seconds, and do it, 3 sets of 10 to 15 times. The next thing that you can do is something called PNF, where you actually contract the muscle for 5 seconds, then relax for 10 seconds, and repeat.
So that's a way you can do it yourself, and then you can get professional help where you have somebody like myself or a stretch therapist at StretchBot come in and actually do the things that I just showed you, but they assist you with it. Here's an example.
Okay, the woman on the table, her name's Janae, and when she originally came in, she was suffering from back problems and tightness in the back, and she sits a lot at her job. So what Fonz is doing now is a form of active isolated stretching, but he's really increasing her range of motion or pushing her past her normal range of motion and then holding it for a few seconds and then releasing, and he repeats it 10 to 12 times on different parts of the body. Right now he's working on her hips, and as you can see, she can move pretty far up. In the beginning, she could barely move. So this is what she's been working on for a few months with us because she continues to have the job that she sits, and it's helped her quite a bit.
So hopefully you learned something. Thanks for taking a look, and you made it to the end of the video. So what I'm going to do is put a link down at the bottom where you get a free PDF on stretches that you can do daily that'll help you get more flexible and release this stuff called fascia or make it looser. So remember, tweak your diet. Try to not eat as many inflammatory foods, or any if you can, but I know how life is. And click subscribe if you liked what we talked about. All right, see you on the next video.